Hello, my name is Susan Mingle. I'm the clinical nurse educator for Med1 Group. I'm here today to provide a demonstration on the Alaris 8015 or point of care unit and the Alaris large volume pump or LVP that will be used in a setting such as clinical trials or drug studies. There will not be a drug library in this demonstration. So I'm going to talk a little bit about some of the physical characteristics of the PCU, point of care unit, and the large volume pump module or LVP. So you'll see it's a large screen. It's surrounded by arrow keys. You have a silence button and an options button. You have your numeric keypad down here, and you have your decimal, which is highlighted in red. On the large volume pump module or LVP, you have channel select. That's how you activate your infusion once your tubing is loaded. You have pause, you have channel off, and you have restart. The Alaris PCU can accommodate up to 4 modules. You can have a single, double, triple, quad. There's no fixed configuration. You can have 2 and 2, all 4 on one side, just whatever works best for your space. They attach and reattach by this button down below that you depress and you lift it off at a 45-degree angle. They do have what's called IUI connectors that will attach to the side of the brain, and you want to attach this at a 45-degree angle, and then you want to make sure you counter press on the other side to hear that click, knowing that it's locked into place and that they can communicate with each other. On the back of the devices, couple things. This is a tamper resist button that you can press for 3 seconds to lock the panel out. This is your pole clamp where it attaches to your pole. This snap here is just where you can fold up your power cord and lock it into place for transportation. And then there is a wireless card that's embedded that's on the back there. So now I'm going to demonstrate priming and loading the tubing. Each of the Alaris pump modules has a door with this latch here that you'll lift up and swing out, and this is where the tubing will be loaded for the infusion. I've already primed the set, but just a couple of reminders. You want to make sure that you squeeze to get your drip chamber 2/3 full. The tubing comes packaged with what's called a protective sheath. This just peels off and it protects this silastic pumping segment during shipping. So as you take it out of the package, you want to close your roller clamp. Again, 2/3 on the drip chamber, then slowly open your roller clamp. And as you're priming, you want to tip and tap these ports, especially if you're going to be doing any secondary infusions or any IV pushes. And this particular set has 3. So as the fluid travels down, you just tip that one up and tap that out of that last port. And then the end cap is vented so you can keep it sterile. The fluid will fill up in the cap until you're ready to connect it to your patient. So loading. This is called the upper fitment. You want to take that above the module and drop it down into the top so it sits right on top like that. The next piece is called the flow stop. You want to put the blue into the blue, snap that into place. And then the last step, there's like a knuckle here. You want to take your tubing and push it in there, push it firmly to the back. That's your air in line detector. Then you'll push everything together and close the door. So now I'm going to demonstrate an infusion, but for demonstration purposes, I have changed out the pump tubing for what's called a cheater set or an education set. So let's go ahead and turn the device on with our system on key. It'll go through a series of diagnostics to make sure that the PCU and the LVP are connected. And the first question it's going to be asking, is this a new patient? So go over to the arrow key that says yes, press it. Patient ID will not be used, just press confirm. And now it's just sort of in a quiet phase. It's telling us with this rectangular prompt bar to select the channel. And we just have the one channel, so it's channeled left to right. We have A. So I'll select channel A, and I'll put in a rate of 125 and a volume of 975 to underestimate a little bit. You do have an option to do volume over time if that's a preference, but for this demonstration, I'll just go ahead and press start. Make sure your roller clamp is open. Otherwise, you will get an alarm, and we'll talk about alarms here in just a minute. So the green light means it's infusing. This is a nurse-designed what's called a lighthouse. When it's alarming, it's red. If it's in a pause or a standby mode, it's yellow. And the pause button we talked about earlier lasts for 2 minutes. And then if you don't restart it, it will alarm, and then you'll have to come back in the room and restart it. So while the pump is infusing, there's 2 buttons that are always available here, the volume infused and the audio adjust. So volume infused just gives you your totals. So at the end of your shift, you would just clear it, and then you're starting with a 0 again. And then we'll go back to the main screen. Audio adjust just turns the volume of the alarms louder or softer. 5 is the loudest. You can test it. And then you could take it down as low as 1, which usually is not recommended. It's very, very quiet. Okay, then we'll go back to the main screen. So let me talk really quick about KVO. So when my volume of that 972 has counted all the way down to 0, I'm going to simulate what the KVO looks like. So I'm going to change my volume, take it all the way down to 0.1, just for demonstration purposes, so you can see what it looks like. Okay. You notice it went down to 1. That's the KVO rate, but it's still green, still infusing, so you have time to go get your subsequent bag, but it's alarming to let you know it will run dry if you don't go get that next bag. So you can press silence and then go get your bag, come back in, spike your new bag, channel select, and this does have a restore feature. It will restore up to 7 hours and 59 minutes. If everything stays the same, the order's the same, the 125, and it would be 975, but remember, I manipulated the number so I could show you what KVO looks like. So I'll just put my 975 back in on my next bag and press start. Next, we're going to talk about alarms and how to troubleshoot some of the most common alarms. One of the most common alarms is, let's say the door accidentally opened during an infusion. This is pretty much a no-brainer. It tells you right here, close the door. It is alarming red because that is an alarm, and it's going to call you back in there. The good news is, remember we were talking about the flow stop. That's designed if, for instances like this, if the door accidentally opened, it is stopping the flow. This clamp ejects. It's like a second roller clamp, if you will, so you don't get a runaway bolus to the patient. So you simply just close the door and you restart your infusion. A second alarm you might get is air in line. If you get air in line, what you'll need to do, you don't have to open the door and pop the tubing out at this point. I recommend to restart the channel a couple of times because underneath the air in line sensor, it will advance that air, and if it's clinically significant, you will be able to pull it out at the port that's just below the air in line sensor, and then you would just restart your channel. Another alarm that can be pretty common if you're new to using this device is forgetting to open the roller clamp. You will get an alarm, and it will say occluded patient side. So you just come in, troubleshoot your line, and realize that you forgot to open the roller clamp, open it up, and then just press restart. When your infusion is complete and you're ready to discontinue the IV, you will simply reach out to the channel off button, press and hold till you hear a slight beep, let go, and it will power the entire system down. This concludes our training. If you have any questions, please don't hesitate to contact med1group.com. Thanks for watching.